So you're getting ready for cataract surgery, and your doctor happened to mention something called exfoliation syndrome. If that left you with more questions and answers, don't worry, you are in exactly the right place. We're going to break down what that means for you so you can walk into your surgery feeling confident and knowing what's going on. Right, so this is probably the big question on your mind. What does this diagnosis actually mean for my surgery? Let's clear that up. You're about to see that while it's definitely something your surgical team takes seriously, it's also something they have a very clear and established plan for. Okay, so first things first, let's get a really clear picture of what exfoliation syndrome actually is. Well, in simple terms, it's a pretty common condition that's related to age, where the body creates tiny, white, flaky protein deposits. And right off the bat, the most important thing for you to know is that this is absolutely nothing you did wrong. It's just a process that can happen as we get older. You know, a really good way to picture it is to think of a very fine, slow-motion frost that gradually forms on the delicate little structures inside your eye. Now, it's not the frost itself that's the issue, it's the effect it has over time that your surgeon is ready to manage. And here's something you might find interesting. It's not actually just an eye condition. These same little protein flakes can also show up in other places, like the heart, kidneys, or even blood vessels. This is why your medical team looks at the whole picture, right? It just helps them be extra thorough with your care. All right, so we've got the frost idea down. Now let's connect the dots. How does this actually affect your eye, and why does it matter for your cataract surgery? Here it is, the main issue, the real heart of it. These little protein bits can weaken the super delicate, thread-like structures that are supposed to hold the lens of your eye perfectly in place. Okay, here's another analogy that might help. Imagine the lens in your eye is like the mat of a trampoline. It's held perfectly centered and tight by hundreds of tiny elastic springs all around the edge. Well, in your eye, those little springs are called zonules. So that protein frost we talked about, it can get into these tiny little springs and over time make them weaker and more brittle. And the end result is that the whole lens structure can become a little less stable. Your doctor might call this zonular instability, but for our purposes, just think of it as a slightly wobbly lens. Now, this creates a few specific challenges that your surgeon is fully prepared for. So instead of a perfectly stable lens, they might find that wobbly lens. Also, the pupil, which normally opens up wide for surgery, might be a little stubborn and have trouble dilating. And finally, those protein flakes can start to clog up the eye's natural drainage system. And that last point, the clogged drain, is a really big one. Because when that system gets blocked up, the pressure inside your eye can start to rise. In fact, having exfoliation syndrome means you have about a 10 times higher risk of developing a certain type of glaucoma. And this is exactly why your doctor will want to keep a close eye on your pressure for the long haul. Okay, I know that last part might sound a little heavy, but here is the most important part of this whole conversation. Your surgical team knows all about this. So let's walk through the proactive plan they have to make sure your surgery is a total success. And I really want to emphasize this. Exfoliation syndrome is not some rare, surprising thing for your surgeon. They have seen this many, many times, and they have a specific playbook ready to go to manage it perfectly. So what does that playbook look like? Well, it all starts way before surgery with a really meticulous evaluation. They're looking for those signs we talked about, like a small pupil or a wobbly lens. Based on what they find, they'll have special equipment and techniques on standby, ready to go, to make sure your new lens implant is supported and stable. So what are these special tools? Well, if your pupil is being a little stubborn and doesn't want to open up wide on its own, they can use these tiny, very gentle instruments called iris hooks to help it along. And for that wobbly lens, they have something amazing called a capsular tension ring, or a CTR. It's basically a tiny, flexible ring that acts like a reinforcement band for that trampoline, giving your new lens a super stable 360-degree platform to sit on. So with all this careful planning and these special tools, your surgery is set up for a great outcome. Now, what about after the procedure? Let's talk about the future and your long-term care. The cataract surgery itself is almost always highly successful, but the real key to keeping your eye healthy for years and years to come is the teamwork between you and your doctor. And that means those follow-up appointments are super, super important. After the surgery, don't be surprised if your eye has a bit more inflammation than average. That's totally normal and completely expected with exfoliation. You'll get a specific course of anti-inflammatory eye drops to keep everything calm and comfortable. And like we said, those regular glaucoma checkups, they are absolutely non-negotiable for your long-term eye health. Alright, so let's just recap the big takeaways here. What do you really need to remember from all this? First off, this is a common and totally manageable condition. Second, your surgeon is well prepared with a specific plan. Third, that long-term monitoring for glaucoma is your best friend. And finally, just by watching this, you're already being a proactive part of your own healthcare team. And that's huge. The bottom line is this: you can walk into your surgery feeling confident, not confused. Your team's prepared, they have a careful, methodical plan in place, and now you know exactly what that plan is. You're ready.